So I'd like to introduce the Sanctuary Plastic Surgery, Charles Riccio. So I've known Charlie for a bunch of years now because he used to come to us when he was a resident at Miami. University of Miami. We got the residents there for training, and he came and he's like basically spent half the year there, right?
Yeah, I feel like I lived there for about a year.
Great. Well, your in-laws were down the street from us, so it was great. So it was nice, and we were trying to recruit him to the practice, and he did a fellowship in Chicago, right?
Right.
Which was really added to your surgical skill set.
Definitely.
And he was working about 30 miles away, and finally we enticed him to come join our practice. And at the time of this filming, he's been with us for 6 months, and I think hopefully for many years to come. And I kind of looking for him to take over the practice, right? There's not many people who could fill my shoes if I want to be myself, but I think that it requires a certain level of interest in new technology and also with learning your craft and becoming an expert in certain things. And really, it's been a pleasure having you in the practice.
Well, thanks. Yeah, I mean, I think one of the things that drew me to Sanctuary was, being around you in residency and seeing the innovation that we put a priority on at Sanctuary Plastic Surgery was super exciting. I mean, there's not a toy you haven't tried out or we played with.
Like you treated my neck a couple of weeks ago, and I trusted you for that. Right. So if I trust you on me, I definitely trust you with our patients.
Right, man. I did a better job. I didn't even burn you.
Franklin does a better job than me, and it takes it's hard to say that ego of a plastic surgeon, right? Especially like lipos. Like my shoulder hurts. Like he does a way better job on a lipo.
I don't even know if I'd say that. I just try to do as good a job as you do.
If I retire, I know the practice is in good hands. Hopefully not for a while.
Hopefully not for a while. We like having you there. Yeah.